Do you have jaw pain that just won't go away no matter how many things you've tried? Here's the surprising part. It might not be your jaw at all. It could be the way your head is sitting on top of your spine. Stick around because I'm going to show you a simple test you can do right now, explain why this happens, and give you an exercise to start fixing it. Sitting just as you are, lightly tap your teeth together. Feel where they make contact. Now tilt your head to the right and tap again. Tilt to the left. Try once more. Did you notice? The bite feels different depending on the head tilt. But here's the kicker. That small shift is enough to start changing the way your jaw joint functions over time. When your head tilts to the right, gravity and muscle tension drag your jaw at an angle. On the right side, your TMJ compresses. On the left, the tissues get stretched. That stretch can eventually cause clicking, while the right side muscles, the masseter, temporalis, medial pterygoid, they become tight and painful. However, if the little disc inside your jaw joint slips forwards, anterior displacement, it often doesn't have space to slide back in. That's when you get clicking, or even worse, your jaw can lock so you can't open wide enough to enjoy your favorite sandwich. So you might be chasing jaw pain with night guards, massage, or stretches. But if your head is off balance, the jaw is just following orders. I had a patient years ago who swore their jaw just started hurting out of nowhere. They tried splints, massage with people, even Botox for the muscles. Nothing worked. When we checked their head posture, their head was tilted nearly a full inch off center. Once we started correcting that, the jaw pain began to settle in just a few weeks. That's when I realized sometimes the jaw is innocent. It's the spine and head position that's the real culprit. So what makes the head tilt? A flat foot, fallen arch, or an actual leg length discrepancy. Your pelvis could be out of alignment, causing an apparent leg length discrepancy, or a torque, causing your spine to lean to that side. Or there might be a cranial dysfunction, such as a torsion in our head. A practitioner who has extensive training in treating cranial base strains can help you with this. It's like building a house on a crooked foundation. The walls might look straight for a while, but sooner or later, cracks start showing up. And here's the thing. Your body is usually amazing at adapting. However, when those adaptations fail, that's when symptoms, like jaw pain, start screaming at you. One of the biggest players here is the upper neck, especially C1, also called the atlas. Now, some people get a little nervous when I mention chiropractic. I get it, but this isn't the twisting and cracking you might imagine. NUCA chiropractors use very precise imaging and super gentle adjustments. Sometimes people walk away saying, wait, did you even do anything? But then their bite feels different. The jaw moves more freely. Headaches ease up. The changes can be huge. Think of a boxer's knockout punch. It's usually a shot to the chin, spinning the head real quick on the neck. That sudden twist irritates the brainstem and the body shuts down. The brainstem goes down into the top two vertebrae. Now imagine a slower version, a constant subtle twist at the brainstem from a misaligned atlas. Not enough to knock you out, but enough to keep your jaw and nervous system irritated every single day. Because the C1 doesn't have the same muscular support as other vertebrae, you can't just exercise it back. But once it's corrected and stable, exercises for posture and the jaw become powerful. So what can you do at home? Because not everyone has access to NUCA chiropractors or cranial specialists. However, there is one simple exercise that can start retraining how your head sits on your spine, the chin tuck. Here's how you do it. Sit or stand tall with your shoulders relaxed. Imagine a string pulling the crown of your head upwards without tilting your head up or down. Gently draw your chin straight back as if you're making a double chin. Hold for 5 seconds, then relax. Start with 5 to 10 repetitions, 2 to 3 times a day. It feels simple, but this helps activate the deep neck stabilizers and resets the head position on the spine. But don't push too hard. If you feel pain, ease up. Think gentle correction, not force. Now, chin tucks are a great start. However, if your suboccipitals, the small muscles at the base of the skull, are locked tight, the chin tuck won't do much. In fact, I've got a video right here on releasing the suboccipitals, the small muscles at the base of your skull. You'll definitely want to check that out next.